live healthy. These include things like access to housing, affordable fresh fruits and vegetables, healthcare access, history of trauma and discrimination, other things in the community such as transportation options that exist. So these factors that we know may help or hinder a person's ability to do the healthy behaviors that we're often encouraging in public health.
How do those health determinants show up in other health outcomes that we regularly work on for chronic disease, for example?
Yeah, so my typical job at the Public Health Department when I'm not serving here in the county's Emergency Operations Center is as the manager for the Tobacco-Free Communities Program, working on chronic disease prevention. And so we know that there are major differences that are impacted by these factors in chronic disease outcomes, for instance. So a lot of our work is focused on prevention of things like heart disease, asthma, lung cancer, and other respiratory issues. And so often we are seeing that in communities where there are factors that hinder people's ability to be healthy, that they are experiencing poorer health outcomes. So higher rates of these chronic diseases, less ability to really change their behavior, get the care they need, are living in neighborhoods where there are more alcohol or tobacco outlets, less healthy food, and those we know are really important factors that we in the Public Health Department are working in partnership with communities and cities to address and change those disproportionate factors.
So how do we normally address some of those social determinants? You mentioned working in partnership. What might that look like?
Yeah, so in my normal job in public health, we partner a lot with our community residents as well as our city officials. We know that if we can have policies that are long-lasting in the community that can really create sustainable change, for example, incentives for corner stores to provide more fresh fruits and vegetables, things like the Double Up Food Bucks program where people can get 2-for-1 options for fresh, healthy foods, things like secondhand smoke protections for people, creating smoke-free places in the community, changing those conditions in the neighborhoods where they are experiencing some of those outcomes. And we do that in partnership and working with our city officials, working with community leaders, working with our healthcare partners and residents to enact those changes and make sure they're having the intended impact that we would like to see.
Great.
Yeah. So Evelyn, I was hoping you could also talk about what considerations of social determinants of health do we need to factor with COVID-19?
Yes. One of the things that we recognize is that the overall county order to shelter in place, except for doing essential activities, poses different abilities for different individuals to participate in that. So for example, you and I are essential workers. We have to come to work every day. We're not able to shelter in place in our homes. Other people are also essential workers working in different sectors that are critical to our continuing functioning within our county. So our grocery store workers, our healthcare workers who are on the front lines, hourly workers, our delivery workers, as we have as broadly have been more and more reliant on delivery services to reduce contacts, that those workers are essential parts of our continuing operation and the economy that's happening. And so as those workers and as individuals are going out and doing those essential work, their ability and their to ensure social distancing is going to be very different. Mm-hmm. We also know that history of poverty, structural racism, educational access are very different throughout our community, language access as well. Mm-hmm. And we want to ensure as the Public Health Department, as the county, and within our Emergency Operations Center in response to COVID, that we are ensuring the greatest amount of protection for all in our community. And so we are really considering how does shelter in place look like for families and individuals where it may be difficult to have a space to isolate when someone becomes sick. So we are working and creating plans to respond to those types of needs. How do we ensure that workers who are continuing to show up at essential work are protected as employees as well? So as part of our new shelter in place order, it included the social distancing protocols that were required for all businesses. That's meant to not just protect customers customers and consumers who may be coming in, but to be protecting employees as well. So we are continuing to further those discussions to ensure that all of our community has access and the ability to have the most protection for themselves and for one another as possible.
That's great. So I know you already mentioned some next steps, but is there anything else that you would want to highlight?
Yeah, I think to what you said about how we do partnership as a core approach to addressing social determinants of health. Because social determinants are multifactorial, they involve business leaders, communities leaders, social service leaders. They affect a lot of areas beyond just the health outcomes that we think about. We have to do it in coordination and with co-leadership with the community. So we work closely, we are currently working closely with many community leaders to identify ways to get our information and our messages out to all communities in our county so they have access to the same information that we provide, that we can customize guidance for different populations as well. And we're letting our community leaders help design that with us so we can be responsive to current community needs.
Great,
yeah.
thank you.
Thank you so much. So thank you so much for tuning in today. We will continue this conversation, and the County of Santa Clara will continue its work to advance equity in this challenging time within the community. Thank you.